Hello, future nurses. Today we're diving into the art of the physical assessment and, the physical assessment techniques. Now, these are just overviews, okay? And as you embark on your, nursing journey, these physical assessment skills will be your trusty companions. Everything is based off of your physical assessment, okay? So let's kind of dive into this. So before we start gathering the tools, that we need to perform a comprehensive physical exam, you know, we have to make use of our senses. As nurses, we use our sight, our smell, touch, and hearing. And, these things become, invaluable instruments in collecting the data, that physical assessment data on your patient. And so, you know, our assessment toolbox is, you've heard about inspection and palpation, percussion and auscultation. And each one of these play a distinct role in kind of unraveling the patient's condition um, and their health history. And these techniques are performed in a specific order, with the abdominal assessment being an exception. Okay, and we'll talk about that later on in the assessment series. So, um, the four assessment techniques. Let's start. So when you break them down, number one is inspection. All righty, this is our first technique. We have to rely on our observational skills, using our vision and our smell uh, to assess our patients. However, we have to make sure that there is adequate lighting. You want to make sure you properly drape your patient. You don't want to totally expose them. So we're going to be using the sheets to drape them appropriately when you are inspecting each part of the body. And you may use, an otoscope, uh, you know, to help with this examination. Okay. When it comes to palpation, using your touch, make sure that your hands are warm. Make sure you warm them up, rub them together, and make sure prior to touching any patient, you perform that, hand hygiene. Um, you'll start with light palpation, and then move on to deeper palpation. You're looking for texture and temperature. You know, remember that when during palpation, if somebody comes in and says, oh, my I'm having left lower quadrant pain, well, you're going to palpate that last. Okay, tender areas are always palpated last. Um, but usually with light palpation, a lot of times we're going to do light palpation. You put your hands on top of each other and you kind of press down with your fingertips. When you're inspecting and palpating the body, you're looking for swelling or kind of rigidity. You'll hear that a lot on the abdominal assessment. Rigidity, the presence of any kind of lumps or masses during this palpation, as well as any tenderness or pain that your patient is experiencing. Then you'll move on to percussion. As nurses, we don't percuss a lot, uh, but it's still part of the assessment techniques that you have to learn. In percussion, it's performed by tapping the skin, and the technique kind of, you know, uh, uh, unveils any kind of vibrations or sounds to see what's going on in the underlying structures and organ characteristics. So it'll give you information like air fluid or solid masses. It will help you determine the organ size, its shape, and its position. But like I said, we typically don't do a lot of palpation, but it's something that we have to learn and put in our toolbox. Auscultation, this is, you're using your stethoscope. Uh, you're listening to the body's heart, their lungs, vowel sounds for presence. You're listening, hey, is it present? And then the quality of it, is there any kind of abnormalities during this auscultation? And it kind of, like I said, lets us detect any abnormalities and kind of assess the patient's overall well-being. Okay. And then don't forget vital signs. Vital signs, people don't typically associate this as part of the assessment, but yes, vital signs is part of the assessment, and pain is a part of your vital sign. So you're going to make sure you take that temperature and that pulse, looking at the radial and the apical pulse, respirations, blood pressure, using that pulse oximetry to note oxygenation status, and also presence of pain. You're going to ask that pain scale, especially if somebody comes in and they're saying, I'm having pain. Um, and all of these, along with height and weight, and even nutritional status, gives you an overall assessment of the patient, and you're kind of putting together all of the pieces of the puzzle. But really realize that assessment really guides the plan of care for your patient. So you're really going to have to hone into these skills, become meticulous at it, um, and that's going to help you be that compassionate nurse that you really want to be. So kind of concluding, I think it's great that you're trying to learn and master these skills. I think it's wonderful that you're embarking on your nursing journey, and just kind of embrace this whole learning process. It's difficult. Nursing is like a foreign language to a lot of people, but just keep practicing. And soon enough, all of these skills are going to become second nature. Trust me. So thank you for watching. Uh, click like, subscribe, uh, send a message, and best luck on your nursing journey. Until next time. Bye bye.